Good morning, good afternoon. Hello, everybody. Thanks so much for coming today. Usually you have Tamara Bingham. As you can see, I'm not Tamara Bingham, but she usually is the one that does the webinars for us, but she is taking some PTO today. So you get me. I am Carrie Jacobson. I do outreach for Center for Change. I don't know if there's some people that maybe don't know Center for Change. Maybe this is your first time on our webinars. We are in Utah. We have inpatient, we have residential, we have PHP, IOP, and outpatient. We have locations in Orem, Utah, Salt Lake City, Utah, and also Boise, Idaho. So that's just a quick about us. I wanted to just kind of get a few things out there. So we've had a couple of people that have struggled that maybe didn't get like a follow-up or a kind of question or an email to get on. So we're trying to work with those folks as quickly as we can to get everybody on. Also the PowerPoint, a copy of the PowerPoint and the post-test is usually in the handouts tab in the toolbar. However, it wasn't there. So we are going to try and get that to you guys, either say in the chat or questions, or somehow we'll get it to you guys so that you have it, because we know how important that is to you folks. Before we get started, a lot of times it's on our website as well, which my understanding it's not there either, and our IT folks are trying to get that on there for you. So if you have questions, feel free to put those in the questions section on the toolbar, and we'll try to get to a few of those at the end. I know Dr. Finley usually gets lots and lots of questions, so we'll try to get to a couple before we have to get off. And then when the webinar ends, please fill out the evaluation that pops up. That will come to you in about an hour after the webinar ends. You will receive a separate email with the link to take the online post-test. To get the CEs, you will have to take the post-test. So that is important. And I think that might be about it. So without further ado, Dr. Heather Finley, I've known her for a few years now. She was part of our outreach team at Center for Change. We absolutely love her and adore her. And if you guys get on Instagram, please look her up. She's got amazing stuff on her Instagram. It's at Dr. Heather Finley. So please, Dr. Finley, go right ahead and get started.
Okay. Awesome.
I will change you over. And I will mute.
All right. I hope everyone can see this. I'm so glad to be here today, and thank you so much. I know most of you are watching this during your lunch hour in between a really busy day of seeing clients, so I really appreciate it. I know you're busy, and I know it's hard to carve out an hour to just sit and listen, and so I hope that you can just take the time to relax and hopefully learn something new. I know supplements are a really hot topic. Obviously, this could probably be like a year-long course, but the goal today is to really just give you some actionable tools that you can use with your patients today or tomorrow. And I know they were having some issues with like the post-test and everything. I went ahead and pulled up the questions. So if we have time at the end, I'll go through and make sure that you have the answers that you need for the test if you don't have access to the slides for after. So stay tuned for that. Hopefully we can make some time for that. So I want to start off by just kind of normalizing the experience as a practitioner. It's always so shocking when you are working with a client and they hand you a list of 25 different supplements that they're taking, and some of them you are maybe familiar with, some of them you aren't, but they, maybe bring in a big grocery bag, they plop them down on your desk, and you're like, why are you taking all of these things? We've all probably worked with clients that want to supplement their way out of whether it's their eating disorder, their anxiety, their autoimmune condition, whatever it is. And they want to combat all the symptoms that they're having too. They want to take supplements for their hair loss, for their bloating, for their fatigue, instead of relying on the most powerful treatment, which can be food, obviously, and also the mind, and the things that we do as clinicians, as psychologists, as psychiatrists, as dietitians. It's very hard when you work with a client that just wants to take supplements. But I want to use this time to maybe bridge the gap a little bit. You really can transform your clients' outcomes when they're able to be more comfortable eating, when they're able to actually eat enough calories so that they can actually prevent their hair loss, improve their fatigue, etc. So there's definitely a balance here, and we'll talk about that. But I want to start off just with a story. So I'll never forget the day I had this client. She walked into my office, like I described earlier, literally a grocery sack full of supplements. She plopped down on the chair. She dumped all the supplements out on my desk, and she was like, I just need to know what I should be taking. So I'm sitting on the other side of the table. I'm completely stunned. I didn't recognize half the names. I had no idea where she even found all of these things. I was totally in over my head. And this woman starts crying, telling me how she basically spent her entire paycheck on supplements, and they had been recommended to her from various providers. She was broke, she was super confused, and she was really frustrated. She's like, I'm still having all of these symptoms that these supplements were supposed to help with. They're not, and that's why I'm here. So in addition to struggling with bulimia, which is why she was recommended to come see me, she was also struggling with acid reflux, bloating, gas, constipation. She was desperate to find a solution. And so she had seen lots of other providers, like I said, and she had all these supplements, and she's like, I still can't seem to get anywhere. So she wanted other strategies. So although this client's supplements, were supposed to be part of her treatment plan, she was like, I can't do this anymore. I need to work on something else, and I need help, and I can't be spending hundreds of dollars, probably close to $1,000 a month, on just taking these supplements. So what I learned as I worked with this client, my initial reaction was just stop all of them. There's no need at all for any supplements. They're not going to help you. But it was a good lesson for me because I started looking up some of the stuff that she was taking, and I started learning about some of these things. And no, she did not need 25 supplements. That was not at all what she needed. But I was able to actually help her pick some targeted supplements that she had or that we added later to actually support her recovery, the discomfort that she had. So my initial instinct to stop everything was a little bit wrong. And I was able to educate myself in helping her to navigate this together. So that's what we're going to go over today. If you haven't attended one of my webinars before, my name is Heather Finley. I'm a registered dietitian. My doctorate is in clinical nutrition. I run a virtual private practice that specializes in helping individuals with digestive issues of all kinds. Many of our clients struggle with disordered eating or have had eating disorders in the past. That's kind of our specialty. And I myself had struggled for years, decades, with my own digestive issues, which is why I'm so passionate on educating on this topic. So, plan for today. First, we're going to talk about just some common scenarios that your clients might have that hopefully are relatable to the clients that you're seeing. Then we are going to talk about when supplements can be helpful, and we're going to dig into just some of the overall research about eating disorders, anorexia, bulimia, and dysbiosis in the gut. And then we're actually going to do some short little case studies on how to actually use these supplements. So I want you to meet Mary. This is a past client of mine. Obviously, this is not her photo, but this is just a placeholder. She was bloated. She was constipated. She was frustrated. And this is probably similar to a lot of the clients that you see. They're having symptoms. Maybe it's reflux, maybe it's constipation. And they don't want to eat because they're having all of these symptoms. And now you're frustrated as the practitioner because you know that if they can improve their intake, if they can eat enough calories, if they can improve the variety of foods that they're eating, that they will feel better. But it feels like this huge barrier to even get them there because they're so uncomfortable. Maybe they haven't had a bowel movement in a week and they're like, I can't possibly eat anything. And so physically and mentally, they're just very, very stressed. You may also have a client that's like only focused on supplements. What do I need to take to prevent this constipation? Or maybe they have self-prescribed a bunch of supplements. Unfortunately, that can definitely happen. So we know that supplements alone are not going to fix someone's problem, but there are things that we can take. So here's the first scenario. Scenario number one, I wish I could see you all because I would love to see by show of hands. I feel terrible when I eat carbs. You've probably heard this before. I can't eat carbs. Anything that has carbohydrates makes me bloated. I refuse to eat carbs. If I just don't eat carbs, then my symptoms are fine and I don't have a problem. There's actually a reason for this, and we'll dig into this in a little bit, but the reason that your client feels terrible when they eat carbs is because carbs have fiber. Fiber affects the gut microbiome. And if they have low levels of good bacteria, high amounts of bad bacteria in their gut, then of course carbs make them feel terrible. They're fermenting in their gut, causing gas production, making them bloated, potentially making them constipated. Maybe you've also had a client that said, I only eat 5 foods, otherwise I bloat. Very similar to the carb scenario, but maybe they know like, okay, these are my safe foods. And as long as I eat these 5 foods, then I'm okay. But I refuse to eat anything else besides these 5 foods. And you know, as a clinician, that's obviously not a good long-term plan, but it's very hard to convince them otherwise because they feel like I'm fine. As long as I just eat these 5 foods, I feel better. There are other reasons why this could be the situation that your client is in. It could be because of dysbiosis, which we'll talk about in a second. Maybe they have histamine intolerance. Maybe they have something else going on, but this is a common scenario. And then the last scenario that I want to talk about is I cannot eat meat, high protein. It just sits in my stomach like a brick. I can only eat foods that are easier to digest because otherwise I feel like I have a brick in my stomach. And maybe it's not even meat. Maybe it's just I can't eat large volumes of food. I can't eat heavy food. I can't eat something that's going to sit in my stomach like a brick. This can be due to enzymes, stomach acid issues. It can be even due to gut motility. There's lots of reasons why this can happen, but these are 3 very common scenarios. So we're going to kind of play off of these throughout the next hour together. So just to define some terms, the first term that I want to define is dysbiosis. Dysbiosis is basically describing an imbalance between the types of organisms that are present in a person's natural microflora. You have bacteria all over your body. We're specifically right now talking about the gut microbiota. That's the colony of bacteria or the community of bacteria that are in the gut specifically. But there are bacteria that are quote unquote bad that can end up in the gut, end up somewhere else on the body that can cause a whole range of conditions or issues. And so this is what dysbiosis is, an imbalance. It could mean someone has too many bad, too little good. It's like a teeter-totter. The balance is off. Now, the next term is probiotic. Probiotics are live microorganisms that are promoted with claims that they provide some type of health benefit by generally improving or restoring the gut flora. We're probably all familiar with probiotics. I think a lot of our clients have probably asked us at some point, what probiotic should I take? And if you are here to learn about probiotics, come in September. The entire talk is on probiotics and prebiotics. I know that this is a question on the test. Probiotics are strain specific. We'll be talking about that in September, how to pick strains for the condition and how to know which probiotics are going to help your clients. And then the last thing I want to define is prebiotics. Prebiotics are compounds that are found in food that induce growth or activity of these beneficial microorganisms, so the probiotics. So you need prebiotics to help flourish the probiotics. And like I said, we're digging into all of that in September. So make sure that you are able to come to this. So let's dig into that first scenario. So the possible reasons for not tolerating carbs. The first is dysbiosis, like I mentioned. If someone doesn't have a wide variety of probiotic bacteria in their gut, or they have too many unhelpful organisms in their gut, this dysbiosis will cause them to not tolerate carbohydrates. So low amounts of good bacteria, which is definitely a possibility with eating disorder clients, like the client I described that's eating 5 foods. You need variety. There's research, and this is a question on your test as well. There's research to show that 30 plants a week helps foster a diverse gut microbiome. And plants does not just mean fruits and vegetables. It means whole grains, beans, legumes, nuts, seeds, herbs, spices, and fruits and vegetables. So someone could have just low amounts of good bacteria, and as humans, we actually can't digest fiber. Our gut bacteria digest fiber for us. So if we have low amounts of good bacteria, no wonder you can't digest carbohydrates. Someone might also not be able to tolerate carbs if they have short bowel syndrome, if they have pancreatic insufficiency, if they have celiac disease, maybe they're getting cross-contaminated and they don't know it with gluten, and that's causing all sorts of inflammation. And then food intolerances. So this is a hot topic, food sensitivities, food intolerances, could be a whole nother lecture, but if someone can't digest lactose, and they're trying to consume lactose, but they don't have the actual lactase enzyme to break it down, then it can cause lots of symptoms. So that spectrum can definitely range. So we want to consider this when we're thinking about our clients, because if they can't tolerate carbs, we want to think about the gut. How can we improve tolerance of carbohydrates so they can improve their intake, improve the variety of foods that they're eating, make it more comfortable for them, and also then improve the outcome of obviously their treatment. So if someone has carb intolerance, it can also be due to the lack of enzymes to digest this. We'll talk about this later, but one of the first steps of digestion is salivation, and meal hygiene refers to this process of how you eat, not what you eat. So how you're even thinking about food before you eat, and how salivation then actually stimulates the release of enzymes and other stomach acid and things that help you digest your food. So if you can't digest complex carbohydrates, what can happen is in the small intestine, where you primarily absorb nutrients, there should be very little gas production there. But when undigested carbohydrates reach the colon, the bacteria that live in the colon ferments them. And so this fermentation often results in the production of gas, similar to, you can think of like grapes being fermented to produce champagne. The buildup of this gas can be very uncomfortable, discomfort, bloating, sometimes pain, etc. Okay, so possible reasons for the second scenario, which is bloating right after eating. So I can only eat 5 foods, otherwise I get bloated and I'm not willing to eat outside of that. Constipation definitely can be a cause of this. If someone can't clear their bowels, you need to be able to empty to then create more room for the rest of the food that's coming along. Bloating can be then actually a negative feedback loop. I know it seems weird to have bloating as the cause of the thing that we're talking about, but the reason that that's on there is because if someone already has excess gas caused in their intestines, this is going to slow the whole system down. All the gut motility slows down, and that negative feedback loop then continues the cycle. Low stomach acid can definitely contribute to this. If someone can't digest their food, they're going to bloat after eating. That's going to actually then impact pancreatic enzymes and other enzyme production. Lack of digestive enzymes, slow gut motility, like I mentioned, and then food intolerances as well. And then the last scenario is food sitting in the stomach like a brick. So again, constipation. I know I talk about constipation a lot, but this can definitely be a cause. Your stomach has to fill with acid to then empty. And if someone's stomach can't fill with acid to empty, it's going to lead to slow gut motility. It's going to lead to constipation. And so again, really, really vicious cycle. It can also be caused, this feeling of this brick sensation can be caused by poor bile flow. Maybe someone doesn't have a gallbladder, that can affect things. If they have a damaged vagus nerve, or if they're constantly in a state of stress, the body is not worried about digesting food if they think they have a tiger sitting right next to them. They're worried about running away from the tiger, not sitting there and breathing deeply and eating a meal while they have a tiger sitting next to them. That's not how our nervous system works. So nervous system dysregulation, chronic stress definitely is kind of the overall thing that can affect this entire process. And then slow gastric emptying, as I mentioned. So with our clients that we see stress, undereating, binging, purging, all the behaviors that tend to happen impact all of these things because it's exacerbating the stress response, it's decreasing all of the enzyme production, it is causing potential gas buildup, it's affecting the overall balance of the gut, and then everything is slowly shutting down, which is why I think the stat that I recently saw is like 98% of people that have eating disorders have some type of GI distress. No wonder. So this all makes sense. So this is kind of what it can feel like when you are working with a client. You're trying to help them eat more, but you just can't. And it can be frustrating for you as the practitioner. It can also be frustrating for the client. Like, I just can't do what you're saying and I want to work together, but I just can't. I feel these physical sensations, and obviously the emotional, mental stress of all of this is then just making it worse. So I want to talk briefly about just some of the research related to GI and eating disorders, and then even minerals, which we'll touch on later. So this first study that I have posted here is about GI symptoms in eating disorders. And basically what they concluded is that, obviously we know this, laxative abuse can cause electrolyte imbalances, vomiting can cause electrolyte imbalances. We all know that. But what we need to do is to assess patients that are struggling with eating disorders to determine how this is affecting the progression of their GI symptoms, because they can progress to a critical condition. And so it's our job as clinicians to be able to assess for these things, know when to intervene, and know when it's a GI thing or when it's not. So this next study is looking at the actual gut microbiome, immunity, neuroinflammation, and then the pathophysiology of eating disorders. And basically what they concluded, this is a recent study from 2021, is that they've found evidence that there are alterations in the gut microbiome and how these can actually exacerbate dysregulated eating behavior, characterized by caloric restriction, anorexia nervosa, even binge eating, bulimia, and how these biomarkers can serve as it can serve as the biomarkers as an increased risk for developing an eating disorder. So we need more studies, obviously, that are looking at the dysbiosis that can occur in the gut, how it affects peripheral inflammation, and then even neuroinflammation, and how all of these things go together. But very, very interesting that they're now looking at the actual bacteria in the gut and the differences between clients that have been diagnosed with an eating disorder and those that have not. The next study is looking at the frequency of eating disorder pathology among patients with chronic constipation and how that contributes. So they found that 19% of chronically constipated people had a clinically significant eating disorder pathology. And so what they're saying in this study is that the constipation that could be also contributing to a GI specific type of anxiety. And so we need to screen our patients for chronic constipation because, again, this negative feedback loop that can occur with the clients that we see. This study is looking at anorexia, and actually it's a fecal study. So it's looking at healthy fecal microbiota and anorexia and the differences there. And what they found is that they are pointing to a really significant role of the gut in anorexia pathology and how these effects affect host energy metabolism, intestinal permeability, or what the mainstream knows as leaky gut, immune function, and then even appetite and behavior. So pretty interesting. And then lastly, this is not a study on eating disorders specifically, but it's just looking at the effect of magnesium in mental disorders. There's thousands of papers at this point on magnesium, and we're going to talk about magnesium in a second, but just looking at how magnesium helps different types of even depressive symptoms, mental disorders. Some papers showed effects, some didn't, and so this was a review of just 12 different studies looking at the impact of magnesium on all of these things. So super interesting. Obviously, we need more studies. I'd actually love to see some studies like specifically on even like minerals and eating disorders, but we don't have that yet. So primary goals of working with a client. If you have a client, even that's outside of the 3 different scenarios that we looked at, so if they even have like burping after a meal, acid reflux, diarrhea, all of these things are applicable. But the primary goals, obviously, of working with our clients are adequate calorie intake. That's number 1. We want to balance their sugar. That's going to help. Adequate hydration. Our clients need to have adequate hydration for so many things, and for even just mineral balance overall in the body. And then diversity of the gut, diversity in food that they're eating, as well as diversity of the gut microbiota. So today, now we're going to cover just some of the basic supplements that are safe to use with your clients and can be used for a variety of conditions. So what I tried to do was pick supplements that could be applicable to a variety of conditions. So that way you feel like you can master a couple things that you can apply to a lot of different types of clients. So the first thing that we're going to talk about is minerals. And the foundation really of everything is minerals. So sodium, potassium, calcium, selenium, magnesium. Minerals are the spark plugs of the body. They do so much for the body. And the interesting piece about minerals is that they all work together. So before someone goes out after this and just buys a potassium supplement, what I want you to understand is that they work like a symphony. So if one mineral is off, it affects everything else. And if your potassium is super high, it's going to affect magnesium. If your magnesium, sodium, they all go together. And so we can't just throw one thing at someone and hope that it works. In fact, that could cause lots of issues. So you need to think about minerals and how they work together as a symphony. Like for example, if your client is taking magnesium, they need adequate potassium levels to actually help that magnesium to absorb. They're cofactors for each other. So minerals basically help the cells go from raisins to grapes. And we want healthy, hydrated cells because these affect gut function, they affect energy, and they affect gut motility. So all of your clients, even that are struggling with diarrhea, if they're constipated, if they're bloated, if they have acid reflux, we need to think about minerals because all of these minerals are going to help the cells go from this to this. And I know a question I'll probably get is like, what if someone has, a blood work and it shows that their magnesium levels are fine? Your body is very good at keeping blood values of your minerals stable. If your blood values of minerals are off, then we have a serious, serious problem, as you guys know. So there could be minerals that need to be supported even if someone's serum potassium is okay. There's other ways that you can measure that, but I know that I'll probably get that question. So the foundational minerals that I want to talk about today are sodium, potassium, and magnesium. As I mentioned, the minerals are the spark plugs of the body. They help things to work. These are just some of my favorite minerals on the bottom because I know I'll get asked like which products. And the reason that I like a lot of these products is because they're balanced with other minerals. For example, this adrenal cocktail has vitamin C and sodium and potassium. The Mag Soothe has a balance, same with the pickleball cocktail. So we'll get into each of these specifically. So first, I want to talk about magnesium. The first step with magnesium is we need to decide what form we need. But just overall for magnesium, we need magnesium for bone density, we need magnesium for sleep and energy, we need it for insulin sensitivity, heart health, it relieves inflammation, it helps with constipation, anxiety, especially if it's a form that crosses the blood-brain barrier, and stress. And the reason there's now, I think, 4,000 peer-reviewed articles on magnesium. The reason that we are magnesium depleted is because our soil is depleted. We lose magnesium through a lot of things that we do on a daily basis, drinking coffee, drinking alcohol, stress, different medications can deplete magnesium. So all day long, we're using magnesium to do hundreds of different things in the body. We also need magnesium to move the bowels. But the interesting thing here is that any inflammation in the gut will actually impact magnesium absorption. So there's a lot of different forms that you can use the magnesium. I'll walk you through all of these, but magnesium is the fourth most abundant mineral in the body. It's a cofactor for 300 different enzyme reactions, including creating energy or ATP. But if you think about the gut as a muscle, you need magnesium to contract the gut, to move things through, to clear the bowels and help with constipation, etc. So to decide what form of magnesium you need to figure out what you need it for. So magnesium malate is a common form people will use for energy, for muscle soreness. Magnesium malate is magnesium that's bonded to malic acid, and it's naturally occurring in lots of different foods, but it's a key component of the Krebs cycle. If you think of like organic chemistry or biochemistry, you probably remember learning about the Krebs cycle, but it's going to support healthy energy production. And lots of studies show that it helps with relaxing skeletal muscles, and it can definitely improve symptoms even in patients with like fibromyalgia. The next form of magnesium is magnesium threonate, and this is very helpful for memory and brain health. It's a newer form of magnesium, and it crosses the blood-brain barrier. So that means that it directly impacts the central nervous system. So your clients that struggle with anxiety, sleep issues, any type of mental health, it is very helpful for cognitive function. And it can also help with learning and retaining new information, which is kind of interesting. So magnesium threonate can definitely be a good intervention if a lot of your clients' symptoms are stress-induced. The next form is magnesium glycinate. It's very helpful for sleep, and it's a chelated magnesium. And basically how it's made is magnesium and then the amino acid glycine. And it's one of the most bioavailable and well-tolerated forms of magnesium. So it's very helpful for a lot of different things because it's really absorbable. It has a calming effect, and it also can help with healthy sleep patterns, like I mentioned. The next form is citrate, and a lot of people get really scared of citrate because it does relax the bowels. You can definitely give someone very loose stools if you overdose this type of magnesium, but it's probably the most common form of magnesium that's used because it's relatively cheap and it's somewhat bioavailable. Excuse me. So this helps because it's naturally acidic and it's bound to citric acid, and it's going to actually help promote muscle relaxation and reduce muscle cramping. So for clients that are very constipated, this can be an option. And then the last form that we'll talk about today is magnesium carbonate. This is actually a really popular form for clients that might struggle with acid reflux. It's a natural antacid. So it can be really helpful if someone is struggling with indigestion because it reacts with stomach acid and then neutralizes the excess acid that is in the stomach. So just to kind of summarize, magnesium can be helpful for reducing stress, improving insulin sensitivity, HPA access support, even energy production, and it's involved in hundreds of different processes in the body. So you're probably wondering, okay, that's great, but how do I actually dose magnesium? We typically start with 200 milligrams of magnesium, usually if it's for constipation or for sleep. We'll do it at night. If it's for stress, you can do it during the day. And we'll increase it by 100 milligrams every 3 to 4 days. That's more like if someone's struggling with constipation. The research is all over the place as far as the upper limit. Anywhere you look, it depends. Some things will say 350 milligrams is the upper limit. Some will say 800. But what I want you to understand, and I know that this is a question on the test, is if you reach really high levels of magnesium and someone's still really constipated, you need to look at sodium levels. You need sodium to absorb magnesium. So that could be why your client is taking so much magnesium and their bowels are still moving, or they are still not moving and they still have really pebbly stool. All right, next up is potassium. So we probably all think of bananas when you think of potassium, but potassium is helpful for nerve impulses. It's also really helpful for thyroid metabolism, hydration, hormones, blood sugar, and even blood pressure, and probably one of the forgotten minerals. There's lots of ways that you can get potassium, either through foods or even liquids, like I have mentioned here. But potassium, we are also depleting all day. Potassium is a stress mineral. When you're stressed, you deplete potassium. So I always think of eating disorder clients when I think of potassium because of the amount of stress that their body is under, the amount of stress that they're under every time they sit down to eat. All day long, they're faced with stress. And so I have to imagine that potassium is very helpful for them. And I've seen this with the clients that we work with. Either encouraging them to consume potassium-rich food sources or using potassium when balanced with other minerals to help improve their symptoms. So we typically look for the whole food form of potassium, so it's more absorbable versus a synthetic form of potassium, and they can be found in several of these different supplements. So this adrenal cocktail, as I mentioned earlier, is balanced with sodium, potassium, and vitamin C, and oftentimes we use this with clients that have POTS symptoms. It's higher in sodium, and so it can be very, very helpful, especially even clients that are really constipated. The higher amounts of potassium in here are helpful. And then this Ravy and the pickleball juice are also extremely high in potassium. They're not going to have as many other minerals in them, but can be great, especially if your client has thyroid issues or is really stressed or really constipated, can be helpful to utilize. Okay, next is sodium. So too little sodium is actually correlated with higher cortisol. So stress, again, here we're talking about that. It's helpful for blood pressure regulation, hydration, stress response, nerve impulses, and then digestion and stomach acid. You may have clients that refuse to eat any processed foods or refuse to salt their food, and this really negatively affects everything in their body. You need sodium to produce stomach acid. You need sodium to help absorb magnesium. And they need sodium to help regulate blood pressure. If they have really low blood pressure, they need sodium to help with that. So again, these all like synergistically work together. So here's just some examples of foods that contain these minerals that we talked about. If you can get them to consume these foods, that's a very safe way to help enhance the minerals, help them to improve their digestive symptoms. And then of course you can use some of the supplements that I mentioned earlier if you want to. So next section of supplements would be herbals. So you've probably heard me talk about ginger before. Ginger is one of my favorite interventions to use for clients that struggle with constipation, struggle with even acid reflux. It can sometimes trigger the reflux to be worse, but for some of our clients, it actually will help. Or even clients that really struggle with slow gut motility, ginger can definitely help. It's the first step of improving constipation is getting the bowels moving. I think that's actually a question on the test as well. And ginger can help you do that. Ginger is an herb. I'm sure you guys have cooked with it or used it, but ginger helps to contract the bowels and it helps with motility. It helps produce enzymes or secrete enzymes for digestion. It can be very helpful for nausea. It can help reduce gas if your client struggles with a lot of what they would describe maybe as gurgly, bubbly stomach. And it also benefits lipase or the pancreas in aiding digestion. So it can be very helpful for a lot of different things and is very easy to incorporate. You can have them, most ginger capsules that you're going to find on the market are going to be about 1,100 milligrams. You can have them take 1,100 milligrams at night. Typically that's 2 capsules. You could also have them do ginger tea. If you don't want to recommend capsules, ginger tea in between meals can be really helpful. As I mentioned earlier, it can trigger reflux for some people where their reflux is caused actually by low stomach acid. It can help, but so you can try that if you want. And you definitely want to avoid having someone take this and then immediately laying down. Ginger is a very spicy, warming herb. And so if you take it and it hasn't quite digested all the way, you're going to feel like your throat's on fire. So take it an hour before bed and sit upright and allow it to digest before you lay down. The next one that I want to talk about is bitters. So I mentioned earlier the cephalic phase of digestion. The cephalic phase of digestion is one of probably the most underrated pieces of digestion because it affects everything else downstream. If someone isn't in a rest and digest state when they eat, if they are stressed, if they're not chewing their food, it's going to affect everything else. And bitter herbs could be part of this salivation and cephalic phase. Bitter herbs are exactly that. They're bitter. They don't taste good. I always get asked the question, can you take these in a capsule? And you can't. There are some products that are in a capsule, but it kind of defeats the purpose. If you don't taste the bitter, you don't salivate. So the point is you take the bitters, they improve salivation. That salivation actually then stimulates your stomach to produce acid. It then also signals to the pancreas to produce enzymes, and it affects the entire digestive process. So it can start the digestive process off a lot better if the pieces at the beginning are missing. Obviously, improving your meal hygiene with your clients, helping them to chew and get in a rest and digest state is the most important piece. But if they're still struggling with lots of undigested food in their stool or lots of gas after a meal or bloating after a meal, the bitters can definitely help. And they can also be used as a symptom relief tool. So you don't have to just use them before you eat. You can use them if your stomach is kind of gurgly or if you have lots of gas. They can be used to reduce symptoms. So we typically recommend one full dropper before meals, taken up to 6 times per day is how you can use them. So let's actually apply this information. And like I said at the beginning, we're going to use a combination of all these things we just talked about to help a variety of different conditions, and I'll teach you how we do that. So the first is constipation. So your clients maybe not going to the bathroom every single day. They are pooping like rock hard, pebbly stool. They're very uncomfortable. Maybe it's causing some bloating as well. So you can use a combination of these things to help improve their symptoms. So you could have them take magnesium either in the glycinate form, if you want to do something that's a little less harsh on the digestive tract, or you could even do magnesium citrate at like 200 to 300 milligrams before bed and see if that helps loosen their bowels. You could even have them try that Mag Soothe powder that I posted a couple slides back before bed, and it would help enhance their sleep, maybe actually help them to have a better bowel movement in the morning. If they're very constipated, potassium and sodium are very helpful as well. As I mentioned, sodium helps with magnesium absorption. So if it's appropriate for your client to consume potassium and sodium, if they're constipated, it can be really helpful. The potassium is going to help with the contraction of the gut muscles. It's going to help with thyroid function, and the sodium then is also going to help with absorption and actually cellular absorption. So you could have them either focus on consuming potassium-rich foods multiple times a day. Maybe they like coconut water. You could have them try that. You could use something like the Ravy powder, the pickleball cocktail, or you could do the adrenal cocktail that has sodium and potassium in it. Maybe mixed with the magnesium and mix it all up, and they could do that. And then you're definitely going to want to use some ginger to help get their bowels moving. This is a really safe, easy option, pending they don't have acid reflux. And if they do, then you could have them try the digestive bitters without the ginger. One dropper before a meal, and then as needed for symptom relief. So the next step, next step is diarrhea. So if your client has diarrhea, you can actually use the same combination, just in a different way. So you might need to improve their sodium balance. If they're pooping 5-6 times a day, they're probably very electrolyte depleted. You're going to want to replete sodium, potentially potassium as well. So again, you could use the adrenal cocktail. You could have them add more salt to their food if they're willing to do that. You could have them use something, it wasn't pictured here, but like Element is another electrolyte supplement that could be helpful. And then the potassium, if they're under stress, you might want to have them add the potassium in as well. The digestive bitters aren't going to necessarily throw someone one way or the other as far as constipation and diarrhea are concerned. They're just going to overall enhance digestion. So if you think the diarrhea could be from like bile acid malabsorption or something along those lines, the digestive bitters could be helpful. If the diarrhea is stress induced, magnesium, like magnesium threonate or glycinate, could be helpful at reducing that stress response because it crosses the blood-brain barrier. So again, 200-300 milligrams a day before bed could be helpful. Next one is bloating, probably the thing that you hear from your clients the most. The first step of resolving bloat is resolving constipation if it's present. Make sure that you get the bowels moving. You're not going to even be able to touch the bloating if someone is constipated because things are sitting in the colon, they're fermenting, overgrowing, causing all sorts of gas and issues. Digestive bitters, you could even use these before meals and in between meals to help relieve some of the painful, persistent bloat that they're experiencing. You can use them, like I mentioned earlier, up to 6 times a day. And then sodium and potassium as well if they are constipated. I would probably even add magnesium in here, but that's kind of coupled with the constipation recommendation. So you could use that if the bloating is caused by that. The other thing that I'll mention that I've mentioned on other webinars is if the bloat is immediately after eating, if they're fine and then they eat and then they're bloated, you want to look at a couple things. One is, are they chewing and are they taking their time? 2 is, are they stressed while they're eating? And 3 is, how is their stomach acid? Are they actually digesting their food? If they're seeing tons of undigested food in their stool, you're going to want to, one, make sure they're chewing, of course, but then also look at the stomach acid piece. Okay, and then the last one is acid reflux. So you could use magnesium in the carbonate form to help as a natural acid reducer. You could use digestive bitters to help improve stomach acid levels and digestion. And then you could also use the sodium and potassium if needed, if stress was a piece, if constipation is present, even if diarrhea is present, you definitely could use that as well. So we use supplements because they can help, and definitely compliance or taking them regularly helps. You're not going to just take magnesium one day and it's going to change everything. So they need to continue taking them and be compliant with the recommendation. We also don't want people to be reliant on them. But simple interventions with supplements could improve your client's compliance with some of the other recommendations that you're giving them. If they now are having a bowel movement every day, if they're now comfortably able to eat and they don't have persistent painful bloating after, think about how overall that affects their outlook, how that impacts even their trust in you, and how they might be more motivated to improve the diversity of foods that they're eating or eat more if they need to, and be more compliant with the recommendations outside of that. So if you're on the last webinar, you probably already got this, but I do have a checklist that has some of these things in it. So if you want the checklist, you are welcome to go to this link. You can fill out a quick survey and you'll immediately get access to the Google Doc. If you just make a copy of it, it'll automatically save on your Google Drive and you can use it as you wish. And I'd love to connect with you. Thank you so much. I think there was, I don't even know how many of you were here, but I really, really appreciate you spending an hour with me today. I love connecting with all of you online, hearing what you learned and hearing what else you want to learn as a result of this. I know there's always more questions and answers sometimes with just a short hour-long webinar. So please feel free to connect with me. I'm happy to answer any questions that you have. And I think I will hand it over to Carrie for questions.
Yeah, you can go ahead and leave your stuff up there, Heather, if
Oh,
you'd like.
okay.
I'm fine for that for sure. So so they can write that stuff down.
Okay.
Okay, so lots and lots of questions. Let me, let's see. One that kind of came up a couple different times, and maybe you can answer, or maybe we need to defer to someone else. If a client is taking medications such as antidepressants or antipsychotics, other types of medications, can supplements be dangerous or negative, like some kind of interaction, like an interaction of it?
Yeah, that's a great question. So everything that I recommended here, the reason that I picked these supplements, there's hundreds I could have chosen, is the reason I chose them is because they're safe for most people. Magnesium is not going to typically interact with most medications. If you want, there actually is a medication interaction like online checker. I think it's integrativepro.com. I can actually look it up really quick. But if you go to integrativepro.com, you have to set up an account with that site, but they have a drug and nutrient interaction checker. So you can put in the medication and it will tell you, do not take these things. But most like minerals, supplements, obviously if someone's taking like a potassium sparing medication, you would want to be careful with that. But most of these are going to be safe for most people, but of course, look it up. That interaction checker is really helpful.
Does that also have kind of guidelines on dosing as well? Or someone mentioned, what dosing guidelines do you follow? Are these based on studies and that kind of thing?
Yeah, so I follow dosing based on studies from all over the place. I wish there was like one central hub that told you like these are the dosing. I do think actually that the integrative site, integrativepro.com, does have some dosing guidelines on there, but I usually defer to like research on that.
And when you were back talking about the complaints about bloating and feeling like a brick in my stomach and that kind of thing, someone asked a question that they typically hear, I ate that and it made my stomach hurt. Is that a different scenario, or does it fit within what you're speaking to?
Yeah, that's a really, really good question. So the answer is maybe both. It could be yes and no. So it could be that if they don't have adequate stomach acid levels, or they have poor pancreatic output, or maybe they were super stressed while they're eating, so like the entire digestive process was just shut off. It could be that their stomach hurts because the food's sitting there, kind of like the example I gave, like they're not going to digest a meal if the tiger is sitting right next to them, they're going to flee. Or if they have a food intolerance, like let's say they have lactose intolerance and they don't know it, that could definitely lead to pain, cramping, and discomfort. So it could really be either.
Let's see. There were a couple of questions about the bitters, the digestive bitters. And someone is asking if you can show the digestive bitters slide again, if you can back that up a little bit. And then someone asked, is there a specific brand of digestive bitters that you would recommend?
Yes, there's a couple brands. I like Urban Moonshine. They have digestive bitters. I also there's some liposomal, which that if someone has absorption issues, the liposomal form can be better. They're literally like twice as expensive, so we try to not recommend those to clients as much. But Dr. Shades it's called Bitter X. Those are probably the two main ones that we use. But the Urban Moonshine is a common one. And then the one thing I didn't mention, which I will since we're talking about this, is they are in an alcohol tincture. So I guess that would be another interaction if you have a client that like can't have any kind of alcohol. Obviously, it's very small amounts, but there are reasons why someone would want to avoid that. There are alcohol-free bitters. Urban Moonshine used to have an alcohol-free form, and I wasn't able to find it the other day, but I know that there are other forms that are alcohol-free.
Okay, well, we are up on our time. There are so many amazing questions. Dr. Finley did put up her information. You feel free to reach out to her with these questions. Also, just a quick thing that the PowerPoint and the post test are now in the handouts. We were finally able to get them on there, and then also we got them on the website. So you can always go to our website at centerforchange.com if you need to go there and get them. So thanks again so much, Dr. Finley. We really appreciate your time and everyone else's time. I know it's a quick hour and so much amazing information. Dr. Finley, are we seeing you again with another webinar?
Yes, so the next one, I don't remember the date, but it's in September, and we'll be talking all about prebiotics and probiotics. I think that I just took a quick look at the questions. There's one question on the test. I can't remember if I covered it or not, but if you're curious, the answer to question number 4, it's Bimuno. That's the prebiotic fiber that has studied for mood enhancing benefits, but we will be talking all about that in September, so stay tuned for that.
Wonderful. Thank you so much, everyone. Have a great day.
Thanks, Carrie.
Thank you.